Hi, my name is Taron. I'm one of the scientists here at Hardy Nutritionals. Today I'd like to talk about patient history or an individual's medical history. This can be helpful in determining best course of action. It can be helpful in guiding treatment or guiding lifestyle choices and things like that if they're applicable. We've talked about these kinds of things before, and we'll mention them again and again because they are significant. But antibiotic use, especially frequent and heavy antibiotic use, can lead to bowel issues, microflora imbalances, and so just to be aware that if that's part of the history of the individual, then it may play a role, and steps may need to be taken to help balance the gut a little bit more, to help with the absorption and to help with kind of improving digestion as a whole. Sometimes there can be genetic factors that play a role in an individual's health. Inborn errors of metabolism like COMT, MTHFR often require specialized nutrients, methylated vitamins specifically, things like that. And so to be aware, if this applies to you, that you may need some of those things in addition to or specifically looking for those as part of health interventions. If it applies to you, hopefully that will help make a difference to your health. Prior drug use, then that refers to both psychiatric drugs and street drugs. All of these types of medications do have an effect on the central nervous system. We find that again, when individuals take these nutrients concurrently with a psychiatric drug or even with a street drug, we do tend to see an interaction, a potentiation of the drug effect. And again, there's a couple of mechanisms that we think relate to that. We know that the nutrients will cause a pervasive upregulation of central nervous system function. So when a drug is present that's acting in the same way on a similar pathway or something like that, we see then a potentiation of that action. Another second mechanism that that the literature certainly indicates is that several nutrients and several drugs or multiple drugs are metabolized through the same CYP450 enzymes, which leads to a competition effect or a decrease in the clearance of drug, which tends to elevate drug concentration. And it's just enough to increase the concentration and add to the increase in side effect profile. We have individuals that have sensitivities. We've come across individuals that have always been sensitive to either medication doses or certain vitamins or minerals that they may have taken, and that may be an indicator that they need a lower dose of the nutrients. And or lower, anything they take will just need to be a lower amount because they can't tolerate high doses. So that's something to be aware of. Another factor, and the last factor that I think that we'll deal with in this segment, is both brain injury and neurodegenerative diseases, neurodegenerative disorders. We have a lot of anecdotal experience with traumatic brain injury and neurodegenerative diseases like Alzheimer's and Parkinson's and whatnot. We find that individuals with those conditions respond well. Well, let me rephrase that. Individuals who've had a traumatic brain injury seem to respond fairly well to the nutrients. Individuals with a neurodegenerative disease or disorder respond well early on. They still respond well in the latter stages with respect to to mood balance, right, and to kind of evening out the mood and temperament. But the longer some of those neurodegenerative disorders go before they start nutrients, we find that the response is slower and perhaps less complete. Also, in a similar category, those that have had extensive history of ECT therapy, right, electroconvulsive therapy, often seem to have a slower response to the nutrients and sometimes a less complete response to the nutrients compared to those who don't have it. But occasionally, there are individuals that respond very well to the nutrients who've had a history of ECT therapy, ECT treatments. Another category of brain issue is epilepsy. And in epilepsy, we've seen not an incomplete, but just kind of an inconsistent response. Some do well, and the nutrients don't seem to have any effect or make any changes to their epileptic patterns. So that's something to be aware of, that the nutrients may have no effect for individuals with epilepsy. But that kind of gives you an overview of what those things. So if any of these factors in assessing the history, assessing either the patient history or your own medical history, if any of those apply, maybe that'll help you to adjust lifestyle accordingly to have a better outcome, to have a better experience with the nutrients.